What is psych? Subjectively. Nobody can see that. But affects in all aspects of behavior. This is a very good, complete definition of mood. Pervasive, sustained feeling tone in a period of time, which perceived internally but affects in all aspects of behavior. Any question? Okay. What is mood disorder? Mood disorder is some disorders affects on your mood, means feeling tone, and also your emotion. And it's very important that in your field, any mood disorders has a lot of morbidity and mortality. What is morbidity? Who knows? Today I want to talk very, very professionally. You learn some new words in medicine. Morbidity means different diseases at the same time. It's very important that you have a patient, you are working on him, for example with stroke, and the patient is depressed. You should know that this depression makes a lot of comorbidity for the patient. It means that a lot of complications at the same time. Okay, the patient is depressed, but this depression makes a lot of comorbidities. It makes a lot of complications for the patient. At the same time, gastrointestinal problem. At the same time, cardiovascular problem. At the same time, infections. See, this is what we call it morbidity. Means when you have a patient with depression, this patient will have a lot of complications at the same time because of this depression. It means that if you treat this depression, even with occupational therapy procedures, in modern occupational therapy, I am teaching you modern occupational therapy. In modern occupational therapy, you can treat depression with occupational therapy procedures. We will work together. As I mentioned, all of you, you know, this is the rule of this university. All of you should have a thesis during your course. A thesis you should defend, you should do a research. And one of the research fields, I think, this is my recommendation to you. You should connect occupational therapy to neuroscience because your field is neuroscience field. And you should be very, very skillful neuroscientist, very prestigious science, you know. Neuroscience now is the most prestigious science in all medical sciences. You should be a neuroscientist. To be a modern occupational therapy, you say that what is your approach? Neuroscience. You can say in your office or in presenting yourself, for example, in your social media, say neuroscientist. It means that approach, do you know what is approach? The strategies you engage in your treatment is neuroscience based. Very prestigious. Very prestigious. So that, okay, everybody say that, why? You say that I am neuroscientist. With which certificate? You say that I have a thesis and I want to establish a club in this university, neuroscience club, that every student who is interested in neuroscience come to this club and having different theses. So you won't have any problem with your thesis at the end of certification. And even maybe we give you some certificate that you are working in this club and you are a researcher in neuroscience field. Very prestigious. Because modern occupational therapy means occupational therapy with neuroscience approach. So, one of the fields you can work on that, treating depression with occupational therapy procedures. Very prestigious. So that no, the treatment of depression is with psychotherapy. So that okay, we have different strategies for treatment. My strategy for treatment of depression is occupational therapy. With neuroscience approach. What is neuroscience approach of treatment of depression? Do we have this? I don't put this. I don't know. At the end, I think I have put yes here. Please look at this picture. This is very, very important to understand. What is neuroscience approach of treatment of depression? Okay. Let me, first of all, by neuroscience, I explain for you what happens during forming behavior. See, when you see something, some event as a stimulus, you see, it activates what? After a stimulus activates what? Emotion. Emotion. There is emotion. Activate here. And this emotion activates decision making and action. But another part is feeling. See here, feeling and thinking happens here. And what time you say that you have problem in feeling, depression? See, we have three main networks which has role in mood disorders, in feeling, in prefrontal lobe. This is dopaminergic network in this field. This is serotonergic network. And this is norepinephrogenic network. What time you are in normal mood? When this norepinephrogenic network, serotonergic network, and dopaminergic networks works in normal zone. Please listen to this part. First of all, your mental health is more important for me. What time you say that these networks are working normal? When your mood is normal. What is normal mood? Who can say? What are the characters of normal mood?
Normal thinking and feeling.
How you say that normal feeling? At this, for example, for how many of you are in normal mood? Yes, please. Normal behavior is the result, but as I mentioned, mood is completely subjective. What time you can say that you are in normal mood? In most of the time of the day and all day during 2 weeks, what should be the pattern of your feeling that we say that you are in normal mood?
Positive feeling.
Positive feeling, what does it mean, positive feeling?
Positive environment.
No. Okay, positive environment is important for having normal mood. What normal mood? What internal perceptions, not external. What is positive feeling? It means that most of the day and all day you should be what?
Having more intensity of happiness.
Happiness, very good. What else? It means that most of the time you should be happy. How many of you most of the time of the day and all day are happy? How many of you? Being happy. What else?
Being satisfied. Satisfied.
Being satisfied. Very good. How many of you are satisfied most of the day? What else?
Comfortable. Being comfortable.
Being comfortable and calm. What else? Please, this is very important because I want you. Yes, question?
You should
yes, these are the results of normal mood. I want that, what perceptions, what feeling you should have, that we say that you are in normal mood. Till now, happy, satisfied, calm, and the characters of normal feeling, that we say that you are in normal mood, that we say that your serotonergic, dopaminergic, and norepinephrogenic networks are working normal and hopeful. My question is that how many of you during the past 2 weeks, all the days and most of the days, you were happy, hopeful, satisfied, and calm? How many of you? Please translate it to Arabic. Everybody understand what is my question?
السؤال هو مين منكم مرتاح وسعيد زين فرحان؟ شنو نقول لنا؟ فرحان مرتاح قسما زين خلال اسبوعين راحه.
How many?
No.
So, you were very good. What else? Please. It's very important for me, because if you are not, it means that these networks are not working well. I mentioned these networks is not just for feeling. What else? Emotion, and when you don't have enough emotion, for sure you cannot do anything. But also thinking. So for sure you won't have good concentration, you won't have good decision making, you won't have good thinking, learning. So you say that no, because the situation is not good. I know. We can say that this is natural result of environmental situation. Yes. But again, we can conclude that these networks are not working normal. If these networks works normal, it means that you should be happy. Okay, the situation is not good. How we can be happy? Say, okay, how these networks works correctly. So that's why most of the time your concentration is very low. Your emotion is up. Most of the time you're just waiting for quitting the class because you don't have any emotion for learning. And in future you won't have enough emotion for working. You know that medical doctors should keep themselves updated. If you don't think that studying will finish after 4 years, your studying will start after 4 years, because you should keep yourself all the time up to date. What is your approach? Neuroscience approach. Neuroscience all the time has revolutions, updates. You should keep yourself updated. And how you want to keep yourself updated without emotion? So, don't think that in this situation we are alive, it means that we are very powerful. Yes, you are very powerful, but this network doesn't work normally. Yes, the environment has stopped serotonergic, normal serotonergic activity. The environment has stopped normal norepinephrogenic activity. What is the complication? What is the morbidities? Decreased concentration, decreased memories, decreased energy, decreased learning skills. So we should work on that. How we can activate these networks? We have some occupational therapy procedures that can activate these networks, can empower these networks. This is neuroscience approach of occupational therapy. In this way, I think we should think about changing this course also, not just occupational therapy, cognitive therapy. If anybody asks me what is occupational therapy, I say cognitive therapy. I think cognitive therapy is more prestigious work. Occupational therapy is very, very simple. Occupational therapy, your work is just for job. Just a patient who has problem in their job. No, who has problem in their school activity, daily living activity. So what is your main concentration? On cognition. So we should say cognitive therapist. And modern cognitive therapist is the approach of neuroscience. This is very prestigious work. I think we should work on that in the society because you are the first graduate students for occupational therapy. I think you don't have this field. Yes, I know. I mean the first in the other universities we don't have. We don't have. We have. So we should think that why we should use the word علاج الوظيفي. I think it's a little low for you. You are cognitive therapists. You are scientists. Cognitive therapy with neuroscience approach. So first of all, think about yourself in mood disorders. I ask you, please consider yourself. How many of you in the past 2 weeks, most of the time of day, were happy, satisfied, calm, and hopeful? So that in this situation, who is hopeful? Okay, I agree. But you should know that it shows that your networks doesn't work well. This is neuroscience. Because if it works well, you should be happy, hopeful, calm, satisfied. And when these networks doesn't work correctly, it means that your concentration is low. Your memory abilities is low. Your learning abilities is low. Your emotion is low. Your energy is low. And I want to tell you another thing. Which part of brain is responsible for regulation the function of other systems? Who knows? One of the most important functions of nervous system is what? Regulation. What is regulation? Keeping the homeostasis of other systems. Which part of brain is responsible for regulation of other systems? Who knows? Hypothalamus, very good, here. This area. We can say that this area is the leader of the body. If you have any problem here, you will have problem in other parts of the body. Hypothalamus, central part, the leader of the body. So, the health of lung, the health of heart, the health of stomach, the health of intestine, depends on the health of hypothalamus. What is the king of the body? Who is the leader of the hypothalamus? Hypothalamus is the leader of the brain, you think? What?
Thalamus?
No. The leader of hypothalamus, which means the king of the body. No. Prefrontal lobe. Prefrontal lobe is the leader of hypothalamus. So how we can understand that prefrontal lobe is working normally? How we can understand? We should go to take MRI, we should go to have functional MRI, we should go and get EEG and understand your prefrontal lobe is working normal. How we can understand it?
Looking to the decision behavior, response.
It's difficult to understand, much more easier that everybody understands that his prefrontal lobe is working normal or not. How we can understand that your prefrontal lobe is working normal or not? How?
And the hypothalamus is normal.
No. How we can understand hypothalamus is normal? It means that how we want to check hypothalamus is working normal. Exactly, normal feeling. When your mood is normal, it means that your prefrontal lobe is working normal. So it can control hypothalamus working normal. So hypothalamus control all of your body and doesn't let any disease come to your body. This is neuroscience. Why we say that in depression you will have a lot of comorbidities and a lot of diseases? Why? Because when you are depressed, it means that your prefrontal lobe, your prefrontal networks are not working normal, so it cannot control hypothalamus, and hypothalamus cannot control diseases in the body. You are depressed, but you have a lot of problem in your cardiovascular system. You are depressed, you have problem in your respiratory system. You are depressed, you have problem in gastrointestinal system. But you are in normal mood, normal function of prefrontal lobe. Your hypothalamus will work normally, and it can control all the problems in the body. So you see that long life without any disease. Again, I hope that you completely understand what I am saying. When most of the time you are not happy, most of the time you are not satisfied, most of the time you are not calm, and most of the time you are not hopeful, it means that your prefrontal lobe is not working normal. So anytime the control of hypothalamus may be out of control, and you are prone to a lot of systematic diseases. If you want to have a good life, healthy, without any disease, the first is having normal mood. Also, you should educate your society. Nobody knows that. Everybody thinks that in this situation, this mood is normal. No. Normal mood means most of the time you should be happy. Okay, what is the benefit? The benefit is when this network doesn't work normally, this is functional problem I told you. That the situation, all the time stress in the environment, all the time the problems, makes these neurons tired and serotonergic activity decreased. So, okay, this is normal consequence of these problems. Yes, this is normal consequence, but you should treat that. You cannot say that this is, okay, you say you drop yourself, I hope you can understand it. You drop yourself from this window and put in the ground, and a lot of bone fractures. This is normal consequence, no treatment. You should treat. You have a car accident and 3 bones you have fracture. Okay, this is normal consequence of this accident. Yes, this is normal consequence, but you should treat. Understand? Okay. Trauma, we have 2 types of trauma. Physical trauma, psychological trauma. We have a lot of trauma in the environment, yes. And this trauma makes abnormality in your psyche, in your prefrontal lobe. this problem is more important than physical trauma. Okay, in physical trauma, you have fracture and you make it, fix it. But these are some local problems. But when you have problem because of traumas, psychological traumas of the environment, and you have problem in these networks, it's not just a local problem. Because this is the king of the body. And it means that when it doesn't work normally, all parts of the body can lose its homeostatic situation. It means that in all organs you can have disease. Still, why? Because this prefrontal lobe is the king of the body, the leader of hypothalamus, and hypothalamus is the leader of the body. So you are prone to all diseases. I hope you can understand that although, yes, these mood problems is the consequence of trauma, psychological trauma, the environment, the situation, but you should treat that. You cannot say it is the natural consequence of something. Yes, this is natural consequence, but you should treat that. Otherwise, you cannot be a successful doctor. All the time taban, all the time no emotion, all the time lose concentration, all the time having problem in learning, all the time having problem in the stomach, and after 10 years, all the time having problem in the heart. So, what we are investing on you in future, we don't have any good doctor. So when you see that, most of the time, you are not happy, satisfied, calm and hopeful because of environmental situation, you should treat yourself. You should activate your prefrontal lobe. You should make homeostasis in prefrontal lobe. Homeostasis here means homeostasis in hypothalamus, means homeostasis of the body. And good concentration, good emotion, good energy, good memory, good learning ability. This is very important. Okay. So neuroscientifically, when you say that patient has some problem in mood, it means that you have some problem in prefrontal networks. And by occupational therapy procedures, or it's better to say in cognitive therapy procedures, you can improve the function of the cholinergic system, serotonergic system, and noradrenergic system. What is the result? Normal mood. How you can understand the patient has normal mood? When you ask, most of the time you are happy? Yes. Hopeful? Yes. Calm? Yes. No, most of the time I'm sad. Most of the time I'm angry. Most of the time I'm anxious. Again, it means that so still this network is not working normally. You should continue your cognitive therapies. Okay. Now we want to talk about different diseases which is because of losing homeostasis in prefrontal networks. This is neuroscientific view, neuroscientific approach. Neuroscientific approach is in this way. When you see a patient with depression, you know that, okay, this patient has problem in prefrontal networks, dopamine, serotonin, norepinephrine. Now I should compensate this defect. I should make homeostasis in these networks. So, now we will talk about different diseases which affect prefrontal networks. First, what is mood disorder? Any problem in feeling, tone, which affects on your emotion. Because between emotion and feeling, you have bidirectional pathway. Feeling affects on emotion. Emotion affects on feeling. Okay. Now, let me give you some categorization because I won't like you be confused. I write something. Okay. If I want to categorize your mind, what is mood disorder? I told you mood disorder are some disorders because of losing sight, neuroscientific, losing homeostasis of prefrontal networks. When we talk about mood disorders, we have two types of mood disorders. First of all, what is mood disorder? When we talk about mood disorders affects on your emotion, status, affects on your feeling status. What is emotional status? High or low? Feeling status high means happy or low, depressed or sad. You should categorize your mind in this way. I am teaching you very, very professionally. This type of teaching is for post-PhD psychology students. But because I have prepared your mind, now I can teach you in this way. Mood disorders affects on emotional status and feeling status. High or low, highly emotional or decreased emotion. Feeling status, high or low. High means euphoria, extreme happiness. Low means depressed. We have two types of mood disorders. Please categorize your mind. What types of mood disorders?
Depression, anxiety.
No, anxiety we don't. We talked about anxiety in anxiety disorders, not in mood disorders.
Bipolar.
Depressive mood disorders and bipolar mood disorders. Very good. So, in depressive mood disorders, you have low emotion and depressed feeling, depressed mood. In bipolar, see now you can categorize your mood. In bipolar mood disorders, you have high emotion and elated feeling, inflamed feeling, which we call it euphoria. So, depressive mood disorders, we have different syndromes. What is syndromes? Syndromes of depressive mood disorders.
So,
No, these are symptoms. I'm talking about syndromes. Different types of depressive mood disorders. Which syndromes you know? Then we talk about symptoms. Major depressive disorder, very good. What else? Persistent depressive disorder, which we call it dysthymia. Different syndromes of bipolar mood disorder. Bipolar type 1, bipolar type 2, and cyclothymic. See, this is categorization of mood disorders based on the status of emotion and feeling. We have two types. depressive mood disorders, including major depressive disorders, dysthymia, bipolar mood disorder, bipolar type 1, bipolar type 2, and cyclotype. Now we talk about symptoms. In depressive mood disorder, we have which symptoms? Okay, this is very important. Please consider this is more professional. That for psychiatrists, you know that psychiatry is a specialty of medicine, but psychology it starts from bachelor, master to PhD. But we have another science, psychiatry. Psychiatry, you should have at first a step be a medical doctor, then a specialty in psychiatry. If we want to talk about the symptoms of mood disorders, I want to categorize your mind. If we want to categorize that when, neuroscientifically I want you to think, when you have a problem in homeostasis of prefrontal lobe, homeostasis of what? Prefrontal lobe. Let me show you again because I want you to understand this part. If you understand this part, you will be a professional psychiatrist. See, these are the networks which has a role in mood homeostasis. So when you have mood disorder, it means that the homeostasis of prefrontal networks has problem. Based on your knowledge till now, how you can categorize different symptoms you have? First, these are the networks of feeling, and we told that, we said that these networks has direct effect on amygdala, so you completely connected. So, one type of symptoms is symptoms which affect on your feeling and affect on your amygdala, emotion. So, one type of symptoms is symptoms which are related to feeling and emotional problems. These networks is also for, in addition to feeling, thinking. So, one other type of symptoms is cognitive symptoms. Affects on your thinking, affects on your memory, affects on your concentration, affects on your learning abilities. Because the same, very in neighborhood networks, when you have problem in these networks, it also affects on your cognition, affects on your thinking. This is the second category. The third category, we said that the feeling, the emotion affects directly again to what?
Decision making.
Yes, decision making is in cognition and thinking. And then execution, exactly. Decision making problem considered as problem in cognitive side. The next is behavioral problem. It means that mood disorders affects on the behavior. So another part of symptoms is behavioral problems. And the fourth, we said that prefrontal lobe has effect on what? Yes, we said feeling, thinking, we said emotion, mood, yes, this feeling, emotion, we said. What other complication of mood disorders? We talked about feeling symptoms, emotional symptoms, the same. Cognitive symptoms like thinking, decision making, behavioral symptoms, and somatic. Very good. Bravo. Why? It's neuroscientifically. Why you should have somatic symptoms in mood disorder based on neuroscience? Why?
Because this is for things are abnormal.
Why you have somatic symptoms? Somatic symptoms is because of what? You have mood disorders in prefrontal because of problems in networks of prefrontal lobe. Why you should have problem in your stomach?
The disturbance of emotion.
Okay, disturbance of emotion happens what? Why? Disturbance of emotion, you will have a stomach pain. Why?
Because all the systems depend on the nervous system.
Exactly. Which part of nervous system? All the homeostasis of all the system depends on homeostasis of which part of nervous system? You said. You yourself answered 5 minutes ago that what is the regulatory system of other systems? What part of the brain?
Hypothalamus.
Hypothalamus.
Yes.
So, what is the relationship between hypothalamus and prefrontal lobe?
Because as you said that the prefrontal lobe is the leader of the hypothalamus.
Exactly. Neuroscientifically, prefrontal lobe control the normal functioning of hypothalamus. And hypothalamus controls all parts of the body. So, if you lose normal functioning of prefrontal lobe in mood disorder, it means that you lose the control and normal functioning of hypothalamus. So the homeostasis of all parts of the body could be disturbed. So you will have somatic symptoms. I hope you understood, because this is very, very professional. So, if I want to categorize in mood disorders what symptoms you have, you should mention what? Emotional and feeling symptoms.
Physical.
Cognitive symptoms. Behavioral symptoms. Because emotion, feeling, thinking affect on behavior, and somatic symptoms. Why? Because you will lose normal functioning of hypothalamus. So, okay, now, all of you, you should give me some examples of different symptoms you expect to have in depression. What symptoms you have in depression, and I want to categorize them inside. Yes? What? I cannot understand honestly.
Weight loss or gain.
Okay, weight loss or gain is which part? Somatic. Very good.
Fatigue.
Weight loss or weight gain, because you lose some homeostatic functioning of gastrointestinal system. What else? What?
Lost interest.
Loss of interest, emotional. What else?
Fatigue.
What?
Fatigue.
Overthinking. Yes? No, step by step. Oversleeping, sleepiness is what? Somatic. The next you should say me. Okay, what else? What symptoms you see in depression? Hmm? Tired. Which part?
behavior.
Somatic. No, tiredness is a somatic sense. You're tired, a somatic sense. What else? Sadness. Which part?
Emotion.
Emotion and feeling. What else?
Loss of concentration.
Which part?
Cognition.
Very good. See, this is neuroscientific learning. What else? Hmm? Be alone?
Loneliness. Loneliness.
Loneliness means you don't have enough capacity to tolerate the others, for example. You mean? It can be a behavioral preference to be alone. What else?
Hopeless.
Hopeless. Well,
Emotion.
good. What else?
Worthless.
Hmm?
Feeling worthless.
Feeling worthless. Very good. Awesome. Very good. This is what you should ask from the patient. What else?
Eat a lot.
Very good. Which part? Somatic. It means that increased appetite, but sometimes you decrease appetite. The somatic, very good.
Fast to be angry.
Hmm?
Having someone fast to be angry.
Irritable, you mean? What part?
Emotion.
Emotion. Remember, I want to explain for you. We have two terms. Irritable. Irritable means your feeling and emotion change very easily, very sensitive. But when it affects on your behavior, what we call it?
Personality.
No. Say you are irritable. Anything, any stimulus makes you sad, makes you angry internally. What is the effect of this irritability in behavior? And you say that very soon he'll be angry and makes a lot of problems, shouting, crying. No. What do we call these types of behavior? Irritability means changing emotion and feeling very easily. When this irritability affects on your behavior, you are angry very, very easily and, for example, shouting. What do we call it? We call it impulsivity. Impulsivity is at the level of behavior. So impulsivity is one behavioral problem of disorder. Because you are irritable, you are sensitive, and you are impulsive. What else? Please think. Think more. Other cognitive problems I told you in addition to concentration.
Maybe suicide.
Oh, thinking about suicide. Negative thinking. Very good. Thinking about what is negative thinking? Thinking about suicide, thinking about death. What is behavioral aspect of thinking of suicide? What is effect on your behavior? This is, we call it suicidal idea. When you decide, okay, suicidal idea, if affects on your behavior, we call it suicidal attempts. Suicidal attempts. What else?
Maybe hurting others.
Exactly. Homicidal attempts, behavioral. call it homicidal. What else? See, categorize your mind in cognitive.
issues in learning,
Very
memory.
good. Learning and memory, and you mentioned
Concentration.
concentration. What else we wrote? Concentration. One of you make problem in before action, after emotion,
Communicating.
decision making, problem in decision making, problem in recording information memory, problem in learning. These are cognitive symptoms. In mania, the pattern of thinking. In mania, excessive thoughts. In mania, behavior.
And imagination.
No, behavioral problems in mania.
Reckless behavior.
Reckless behaviors, risky behaviors, certain behavior. In depression behavior,
Low emotion and low behavior.
what do we call it?
Uh,
Decreased behavior. We call it decreased psychomotor activity or slow psychomotor activity. Because you don't have enough emotion, your activity decreased. Delayed reaction. And it's very, very dangerous. You are driving and suddenly you should put on the stop. But because of decreased psychomotor activity, till the time you want to stop, you will have accident. So in this way, you should know different symptoms of mood disorder. You should know what's the reason of somatic, you know, because prefrontal lobe control, hypothalamus control the body. Problem in prefrontal, problem in hypothalamus, problem in the body, somatic symptoms. Cognitive symptoms, okay, neighborhood of the networks of cognition is in prefrontal lobe. Behavior, all the pattern of behavior depends on the pattern of feeling and emotion. So when you have problem in emotion and feeling and thinking, for sure you will have behavioral problem. One type of abnormal thinking in cognitive, in mania, which is very, very prevalent. Who knows? Grandiosity. You think that you are better than the other. These are some cognitive problem that you think that you are better than everybody.
Narcissistic.
Hmm?
Narcissistic disorder.
What disorder?
Narcissism.
Narcissistic is a pattern of personality disorder. But grandiosity, you have grandiosity in bipolar. The same, in narcissistic personality disorder, you have grandiosity. But now we are talking in mood disorders. So now you can categorize your mind when we talk about different symptoms of mood disorders based on your neuroscience and which networks are involved. You will have emotional and feeling symptoms, cognitive symptoms, behavioral symptoms, somatic symptoms.
So what's the main difference between behavior and somatic?
Somatic, we mean systematic symptoms in other systems. You know the meaning of behavior. You want to say that behavioral is a part of somatic. Yes, but we can categorize in more details. Somatic is better to say systematic. Means the problem in other systems. In another categorization, as you want. For example, you can categorize symptoms to two parts. Psychological symptoms, which include what?
Emotion.
Emotion and cognition. And physical or somatic. Behavioral and systematic. Yes, we can categorize it. But my goal is just you can know all the symptoms because you should ask from the patient. You can categorize in more easier psychological symptoms, physical symptoms, including behavior and systematic symptoms. But it's important that you keep in your mind that in mood disorders you have different symptoms and you should ask from the patient. Now go through the slides, understand this part. Okay. So, we divided mood disorders to bipolar disorders and depressive disorders. About bipolar disorders, in bipolar type 1, we have manic symptoms. Again, when we talk about manic symptoms, you should consider feeling and emotion symptoms, cognitive symptoms, behavioral symptoms, and systematic symptoms. So, now, what is bipolar type 1? You have mania episode. What is mania episode? In 1 week, you have manic symptoms. What is manic symptom? Now I want you to tell me what are the category of each symptom. We had this in past semester, so we are in review. What is elevated mood? Feeling. What does it mean?
Emotional.
No, feeling. It means that during 1 week, most of the time, all the days you were
Excited.
Happy.
very happy, very excited. What do we call it? Very excited and very happy?
One.
No. Yes, mania, but this is just elevated mood. Mania is a syndrome that all these symptoms you have. What do we call it? Very excited and very happy?
Elevation.
Like this or
Euphoria.
also.
Euphoria. And increased goal-directed activity. In which category? No. Increased goal-directed activity. In which category of those 4 category?
Behavior.
Behavior. Increased goal-directed activity. Why increased goal-directed activity?
Thinking. Overtime.
Overthinking, emotion high. Emotion is the energizer of behavior. So we will have increased goal-directed activity at the level of behavior. Grandiosity,
Behavior. Behavior.
effects on behavior. Also you can say, but mostly before behavior,
Cognitive.
cognitive, that you reach to this belief that you are better than the others. But for sure it has effects on your activity. Diminished need for sleep, somatic, very good. Distractibility, very good. Racing thoughts, overthinking, cognitive, which leads to increased goal-directed activity. Increased pressure speech,
Behavior.
better behavior, because speaking is a type of behavior, but you can say somatic also, because behavior is a type of somatic. Reckless behaviors, behavior. So, when you have 4 of these symptoms, you say the patient is in manic episode for 1 week. This is mania. When the patient has 1 episode of mania, you say bipolar type 1 disorder. What's the meaning of disorder? Affects on your normal performance, normal activities. Okay. Elevated mood can also be irritable mood. It means that all the time your mood change. Also in mania, irritable mood can be a part of mania. But bipolar type 2, that is bipolar type 1, that you have episode of mania. But bipolar type 2 is what? You have episodes of hypomania and major depressive episode. This is bipolar type 2. Bipolar type 2 major depressive episodes and hypomania episode. Bipolar type 1 mania episodes. So now you should know that what is hypomania? Hypomania, all the symptoms the same, but with lower severity, which does not affect on the performance. Understand? That you have loss of concentration, elevated mood, but lower severity, grandiosity, overthinking, pressure of speech, reckless behaviors, increased goal-directed activities. The same, but in lower severity that does not affect on your normal performance, especially in your social activities and job. When you are in hypomanic episode, your activities in your job and in your communication, you don't have any problem. This is hypomania. See, exactly the same. Irritable mood or elevated mood, increased goal-directed activity, grandiosity, diminished need for sleep, distractibility, racing thought, increasing speech, reckless behavior. You can see the same. But in manic episodes, these symptoms affect on your social or professional activity, performance. But in hypomania, these symptoms doesn't affect on your performance. In hypomania episode, you have normal communication. You have normal job activities. So, again, in bipolar type 1, you have manic episodes. In bipolar type 2, you have hypomanic episode plus major depressive episode. If anybody asks me, what is the most dangerous syndrome in psychology, is manic episodes. The most dangerous, because you do a lot of reckless behaviors, makes a lot of danger for the patients and the others. Very dangerous. Schizophrenia, a lot of problem for the patient, but most of the time not for the society. But mania, some driving, very fast driving, and kill 20 persons at the same time. Mania is very, very dangerous, because also they have loss of concentration. During driving, do not have enough concentration. And also because of grandiosity, deciding very bad decision making. When the patient is in manic episode, he should not decide. If decide, he can destroy the money of a company. Okay. Understanding the meaning of cyclothymia is very important. Very important. Because, let me show you. You understood that normal mood is the result of normal function of dopaminergic system, serotonergic system, and norepinephrogenic system. When you have normal function in these networks, it means that you are in normal mood. makes dysfunction. For example, a lot of problems in the environment happens, but dysfunction keeps normal function. How? For example, a lot of disasters happens, but still these systems works normally and keep you happy, keep you hopeful, keep you thankful, keep you satisfied. We use a term, emotional regulation system, feeling regulation system. In developmental psychology, we talked about that. Can you remember developmental psychology? In developmental psychology, when we talked about development of emotion, we said that some emotional regulatory systems developed during neurodevelopmental period that keep normal functioning of dopamine, serotonin, and norepinephrine. We have regulatory systems that keep normal functions of dopamine, serotonin, and norepinephrine. You know that cyclothymia happens in early stages of life. Bipolar mood disorder can happen in any parts of the life, that emotional and feeling activity increase. Depression can happen in any time of life. But cyclothymia most of the time happens in early stages of life. Why? Because we have a theory, neuroscientific theory. That's why I tell you, if you learn psychology, occupational therapy, cognitive therapy in neuroscientific approach, in cyclothymia you don't have regulatory system of the feeling systems. What happens? From the early stages of life, you have fluctuations in your mood. One time in depressed mood, one time elevated mood, again depressed mood, again elevated mood. Is it because of the environment? No. Cyclothymia has completely biological basis. Even in my opinion, cyclothymia is a type of neurodevelopmental disorder, which development of emotional system is disturbed. This is why we have developmental psychology also in your course. Please review it. Developmental psychology, the subject we talked about emotional development. In emotional development, we said that during neurodevelopmental feeling and emotional regulatory system develops that keep the homeostatic function of norepinephrine, dopamine, and serotonin. So, imagine that this regulatory system is not developed completely. Sometimes increased function of feeling networks, again decreased, again increased, again decreased. Because regulatory system cannot keep the homeostatic function of these networks. So, neuroscientifically, we can consider cyclothymia is because of some neurodevelopmental problems in emotional system, feeling system. That you don't have a homeostatic function of prefrontal lobe. So, in cyclothymia, you see cyclothymia in early stages of life. That's why in children, when you have such this fluctuation between elevated mood and depressed mood, elevated mood and depressed mood, even in children and childhood and adolescence. But at that time, if you see that the patient has such this fluctuation for 1 year, you should diagnose cyclothymia disorder. And this is very important that you diagnose early. Because with some cognitive procedures, some occupational therapy procedures, you should try to improve emotional regulatory system that can keep the homeostatic function of prefrontal. So diagnosis of cyclothymia is very important because it shows some biological problem in emotional regulatory system which keep the homeostasis of prefrontal lobe function. Understand? So in cyclothymia, you have fluctuation between elevated mood, depressed mood, elevated mood, depressed mood. Not because of the situation of the environment, because of some biological problem in emotional regulatory system. So if I ask you, which is very, very difficult question, very difficult question. Which of these diseases is mostly because of problem? We can have this question in developmental psychology. Which of these disorders is the result of development in emotional regulatory system? Cyclothymia. Because you don't have regulatory system, all the time fluctuation between depressed mood and elevated. This is very, very special question, that a very, very good question. Okay. So, major depressive disorders we reviewed. You have depressed mood and other symptoms together for 1 week, for 2 weeks. We say major depressive episode. When you have major depressive episode for 2 weeks, you have major depressive disorder when you are during this episode. What are the symptoms? Sad mood. In which category? Insomnia. In which category? Insomnia. Better stomach. Feelings of guilt. Feeling or thinking. When you feel guilty, you believe that you are guilty. But the same, psychological. Decreased energy level. Somatic, better say, or systematic. It's better to say systematic. Decreased concentration. Cognitive. Decreased appetite. Somatic. Decreased in pleasurable activities. Behavior, very good. Increased or decreased psychomotor activity. Behavior. Recurrent suicidal ideation. Cognitive. Or suicidal attempts. Behavior. Attempts is behavior. Very good. We will see you next week, inshallah.